Hey there. Everybody. Hey, Tasha, how's it going?
I'm good. How's everyone?
Good.
Hello, 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 and welcome everyone to the Community Builder Approach to Postpartum Care webinar. We are so excited to have you here. But before we get started, I want everyone to put in the chat where you're coming from. I'm coming to you from Snellville, Georgia. And as everyone is doing that, the most important thing we want everyone to know that this is a safe space. We will do no mommy shaming here. So you are able to be free and be yourself. All right? Okay. So, Latasha, whenever you're ready, I'm ready.
Awesome. Okay, I'm going to share my screen. I hopefully share out my screen. All right. Can everybody see my screen okay? You can just give me a thumbs up, Rachel and Tosh. Perfect. Thank you. Oh,
Looks
thank you.
good.
Awesome. Well, welcome, everyone. We are so happy to have you here. Rachel, I will pass it over to you for intros.
Yes. Hello, everyone. I hope you all have had a wonderful time thus far, this Black Maternal Health Week. I know that there's been a lot of information coming to you guys, and special thanks to Birthing the Magic, because this is huge. And having all of these educational sessions is so important for not only providers and birth workers, but of course for moms. So a huge, huge kudos and a thank you to the organizers of this Maternal Health Week information and educational session. So thank you so much. My name is Rachel. I am the Director of Community and Client Relations at Postpartum Peace of Mind. And my co-founder here is Latasha Reese, who is the Executive Director of Postpartum Peace of Mind. And just want to give everybody kind of a brief overview of the two of us and our backgrounds. Tasha and I both did study science, so we have our degrees, our undergraduate degrees in biology, and Tasha also went on to get her master's in exercise physiology, and she's currently working on her PhD in research. So there's a lot of history and thankfully knowledge as we've been learning together and moving forward. And we've been friends for about 14 years now. So it's been quite some time. And you'll hear a little bit more about Tasha's story going into it, but her story is the driving force behind the work that we do. And seeing what happened and what is happening to Black moms all around the country and even in other parts of the world, it is the reason why we are here and we want to change those maternal health outcomes. Right, next slide. All right. And as Tasha, the other Tasha, had said, this is a safe space. So just some friendly reminders. We welcome questions. We want you to speak, whether it is through the chat box, or I don't know if everybody has the option of coming off of mute, but if you are able to unmute yourself and you want to add something or you have a question, please do so. And there's also going to be an interactive portion of this session. We don't want it to just be talking at you, but we want you to participate. We want you to ask questions, and we also want you to be able to be involved. And then lastly, again, our intention is to not do any harm, and you need to do what it is that you need to in order to support yourself. So snacking, everything like that. If you need to step away, we will discuss portions of this presentation. Will discuss trauma. It's not a large piece, but it will discuss trauma. So if that is something that is you're unable to listen to or you're uncomfortable with, just want to preface with that so you are aware. And we can also highlight that prior to getting to that slide.
So what we will be discussing this evening. So one, we're going to talk about the maternal health crisis as well as postpartum care. So I'm sure, especially if you attended multiple sessions throughout this week through the Safer Births Now virtual health conference, if you have attended any other events for Black Maternal Health Week, you are well aware of the maternal health crisis. And not only are you aware of it, but you've dedicated your time and I'm sure resources to addressing that crisis. But that's what we're going to talk about tonight. We're going to talk about our solution. So the solution that we use with our clients as a nonprofit to help address barriers to care. Then we're going to reason together. So we're going to have a case study that we're going to do. We're going to do it very interestingly in a virtual setting. So we do ask that you be patient with us now, but we are looking forward to getting your feedback. And then we're going to talk about who's in your community and leave some space, some reflections and questions. So the first question that we want to ask, and we encourage you to come off mute if you can, or answer in the chat box. So why is healthcare, the wider healthcare system, failing Black mothers? Not a rhetorical question. We encourage you to answer. We'll give you a couple seconds and then we'll jump into the data. Systemic racism. Thank you, Patrice.
Mm-hmm.
Misogynoir and capitalism.
Racism and capitalism. Those are some
Implicit
good answers.
biases. Simply not
Lack
being
of
good at it.
access.
Lack of
Yeah.
access. All of the above. Thank you, Marie. Removal of persons and genocide. To end the race. That's deep. These are all incredible answers. And not only are they incredible answers, loss of cultural and practices, Black women are strong and don't need help. All of these are evidence-based answers. I just want you all to know that all the things that you're saying are coming up in the literature. All the things that you're saying are coming up in those conversations when, you do qualitative data collection, when you interview these moms and listen to their stories. These are the things that they're saying. And I'm sure some of the things that you're saying are coming out of your own personal experiences. So I thank you for participating. And again, we encourage you to continue to participate as we go. I'm so sorry. I'm going back one. There we go.
All right. So, yep. So as a lot of information has come about, but a study that was published in 2021 by the CDC found that an average of 80% of maternal deaths in the US are preventable. So that is something that is huge. We're seeing so many deaths that are avoidable. And unfortunately, just recently that was highlighted in the news was the, I believe she was a software engineer and also a cheerleader. So a lot of people highlighted the fact that she was a Kansas City Chiefs cheerleader, but she was also a software engineer. So you can see that education and socioeconomic status, unfortunately, for her case, it really does not make a difference. We are dying avoidable deaths. We're dying for reasons that should be prevented at this time in year 2024. Unfortunately, this is still going on, and Black women are 3 to 4 times more likely to die of perinatal complications than their counterparts. So that's 55.3 deaths per 100 live births. So it's a lot that is unfortunate and that's happening in our communities. And about 53% of the perinatal complications occur during the postpartum period. That is something that Tasha and I and a lot of other organizations have dedicated their time and their efforts to seeing that no longer happen. As I mentioned, the software engineer that just passed away, unfortunately, she passed away from sepsis. So, and this is just another case of the thousands, of the hundreds of thousands that have taken place in our country. Keep going to the next. So we can look here and see what is the cost of suboptimal care. One of the main things is mental health. 29 to 44% of Black women experience symptoms of postpartum depression. And unfortunately, a lot of these are not as reported because there is a stigma. There's a lot of barriers. So there are a lot of Black women that aren't actually initiating care because of these different societal issues or just generational issues that they may come against, and they don't actually speak to it. One of the common things as well, unfortunately, in a lot of mainstream media, should I say, or mainstream doctors, how they look at things, it may be depression, where it's you're crying, you're just under the covers, and you're talking about how depressed you are. And there are studies that are out there that show that Black and brown women do not present the same way when they are experiencing postpartum depression. They experience it physiologically. So whether that's pain in the body, whether that's excessive tiredness, there are other ways that it is presenting itself. And there's so much data that is out there, or there's more data now in these days that is out there that is showing how that works for Black and brown women. Secondly, breastfeeding and the cancer incidence. Black women are the least likely of ethnic groups to initiate and continue breastfeeding. There are studies that prove that breastfeeding is so helpful for any other comorbidities that Black women, unfortunately, in our cultures that we experience, whether it's hypertension, it's diabetes. There is a lot of research that shows that breastfeeding can help with that. We're 41% more likely to develop cervical cancer and 75% more likely to die from it. So these incidences of thyroid and cervical cancers are almost 2 times higher for women who do not breastfeed compared to those who breastfeed at least 6 months. And unfortunately, things that we've just heard from our clients that we work with is that they're immediately pushed into having formula. They're immediately told, hey, let's get you started on formula, versus let me make sure that you're comfortable with initiating breastfeeding. It's easy, and we'll get a little bit more into it a little bit later on, but it's easy for a mom to just say, or it's easy for a provider to just say, well, here's formula, here's for baby, and you can go on ahead and just do that. However, we are not taking enough, or we're not getting enough support in the breastfeeding and lactation area as Black and brown women, but primarily Black women. And then our last point here is perinatal complications. As mentioned before, infections such as like sepsis, embolism, postpartum hemorrhages, preeclampsia, eclampsia, preterm birth, pregnancy, loss, and stillbirth. There are so many perinatal complications that Black women are experiencing. And as I mentioned before in the previous slide, there are a lot of things and ways to combat these different complications that we're experiencing.
Before we continue, there was a question in the chat box, and it's a great question. So the question is, do we know how far out in the postpartum phase Black women tend to die from complications? Do we need to focus on the issue right after birth or later in the game? So research has found that in general, perinatal complications or postpartum complications are technically measured from immediately after birth up until 1 year postpartum, right? So there was recently a study that was published that said that these complications can occur up to 2 years postpartum, including complications related to mental health disorders. So our recommendation and the way we do care is it's all about preventative care, right? We try not to wait until something happens to start treatment, or just make sure that mom has support. And we'll talk about that once we get to our care model. So our goal is to make sure that mom has access to someone who supports mental health, ideally before baby is born. It's our goal for families, communities to be aware of perinatal complications prior to baby being born. So that way, if something does happen, it's less us trying to catch up. We're trying to be proactive. That's what I'm trying to say. Our goal is not to be reactive, not to wait and see what happens, but to be proactive, for mom to be aware, not afraid, but aware of what the signs and symptoms look like of preeclampsia, for example, right? Other common, like Rachel just went through, those complications that are either most or likely to occur in Black and brown women. We want them to be aware of those, so that way they can advocate for themselves in healthcare spaces. Amazing question to whoever sent that. This is my slide. Yeah. Okay. So research suggests, so these are a few other contributing factors to the high mortality and morbidity of Black and brown women based on a recent study. And we have all our citations on the slides. So that way, if you do want to review the literature, you can feel free to reach out to us and we can send you any of the references that we have, as well as additional resources if you're interested. One is access to healthcare. We say access is everything. Right. So that includes preventative care. That includes making sure that mom has access to prenatal care and childbirth education and things like that. All of those are preventative care measures. Those are ways to make sure that mom is prepared for childbirth and postpartum. Inequitable care, including poor communication and disrespect. This was my experience having my babies, right? This is the reason why I reached out to Rachel the early last year and was like, hey, I want to start a nonprofit. Because when I had my children, I had both my girls during COVID, and my background is in molecular biology. I have a master's in exercise physiology. I'm a professor. I teach at a local university. My husband is a marine chemist, right? None of that mattered. We got to the hospital. We were immediately separated because for some reason, the security guard thought my husband was a criminal and that I was being trafficked. No joke. Not because of COVID protocols. We did everything we were told to do. We talked to the nurse that was on charge and told her, hey, we're ready. We did a COVID test within 24 hours. She said, come on in. We're ready for you. And when I got upstairs, I said, why were me and my husband separated? She told me why. And she said, well, you gave birth in the middle of the night. I said, most women give birth in the middle of the night. Clinically trained physiologist. I know how this works. It didn't matter, right? With my second baby, I had postpartum hemorrhages with both of my children. And with my second baby, I had a nurse on my side. So I'm hemorrhaging, I'm bleeding, I'm trying to initiate breastfeeding. My midwife is trying to save my life. My husband is trying to be there for everybody all at the same time and doing the best he can. And this nurse asked if she can fudge my numbers in their system because she doesn't feel like printing off the AIM toolkit. So if you're not familiar with the AIM toolkit, it is a federally mandated packet that is supposed to support moms by educating them on perinatal complications and how to care for themselves after a postpartum hemorrhage. It is required by the government, but she didn't feel like pressing print. That's inequity. And I gave birth at a hospital in a primarily affluent area in South Florida at a hospital that has an established postpartum program. And this was my experience. And what Rachel and I were most concerned with is imagine the moms that don't have the language to advocate for themselves. What then? So, another thing is the lack of standardized evidence-based maternal care practice. There is so much research that supports care and how to provide the best care. But a lot of that research is not done on Black and brown women. So if care doesn't look the same, if we know that we don't experience postpartum depression the same, then why isn't it better specialized to the population that's in need? Inadequate implicit bias training, someone put in the chat box, it's so important. There was a Harvard study recently that showed that there are young physicians, medical students, who are probably physicians now, who still believe that Black people have tails. That we have vestigial tail, that we still have tails, and that Black people don't experience pain the way that their Caucasian counterparts do. These are Harvard-trained medical students. Inadequate training, social, such as education, housing, and economic status, that's not considering the social determinants of health and how we prepare moms for having their babies. And it can all be encompassed with an outdated model of perinatal health care. Rachel, it looked like you had something you wanted to add.
Oh, no, I was just saying that somebody was asking for about the AIMS toolkit.
Oh,
that you were referencing during your explanation of inequitable care. But Miss Marie was able to give them the Google link so they can see it.
best. So let's discuss the solution. So this is how we address postpartum care with our clients. This is a model that we are validating, and so far it has provided very favorable results. So we asked this question, and I have to thank you all again for engaging with us. I see all the messages coming up in the chat box and I keep getting excited and I'm like looking down and looking back up. But thank you so much for engaging with us this Wednesday night, because this is not even like this is Wednesday night. This is
on the East Coast, it's
on
Wednesday
the East
night,
Coast, it's Wednesday night. You are is Wednesday night. So we are just so grateful. Okay, so here's a question for the group. And again, if you want to be unmuted, please, I think it was in the chat box that you have to raise your hand, or we encourage you to use the chat box. So what if every mother had access to evidence-based services to support their physical and mental postpartum recovery, right? So Rachel provides the best grounding for this. So imagine a perfect world where there's no barriers to care. What services, what would that world look like for you? What services do you think that moms should have? What outcomes do you think that Black and brown moms would have if there were no barriers to care? No racism, no systemic biases, no stupid security guards that separate people when they're, having their first babies, like all these things. If none of these barriers to care were there, what would that look like? I'm opening the chat box because I want to see too. Reduce maternal mortality rates.
Good answers.
Yes. Less mortality. Less postpartum depression. And less suicide rates. Absolutely. They could experience the beautiful natural process of childbirth. I have heard women that have found out that they were pregnant and bawled. Just not out of joy, out of pure fear. Like, say that they are so afraid to have a baby in America. Like, this woman was crying because she was afraid. And it's the worst experience to have on the other side of it, just listening and wanting to offer some comfort, but also being aware of the gravity of the situation that we're in. It's rough. Perinatal care aligned to their wishes and concerns. Yes. Yes. Such amazing answers.
Yes, and just to piggyback off of what you had said, Tasha, about that individual being so afraid and so terrified because they they're finding out they're pregnant and they are a Black woman in America where we are surviving birth. And to Miss Brittany's point, you do want to be able to experience that beautiful, natural process of childbirth and not feel as though you survived childbirth. You want to be able to be excited with your partner and go to the hospital knowing that you're going to come out with a healthy baby and not worry, well, this is what we have to do if I don't make it. This is what I want you to do if I don't make it. Those are real fears that Black women are experiencing in this day and age. And to me, it's appalling. And we want to change that narrative. That's why we're all doing the work that we do. We want to change what that looks like. So yes, all of those answers were awesome and so true. Next slide.
Great. Yes.
All right, so this is the care model that we've proposed that we have been using with our clients, and we've gotten some really great feedback on that. And this is the community building to support or our perinatal care model, but it is in order to help support women of color. And this is what the new standard of maternal health care should look like, right? So as this is, you see these 5 different points, and I'm so sorry, I talk with my hands, so I apologize. I should have prefaced this entire thing by saying that, but I talk with my hands. You can see every point there where if every mom had access to a doula, to physical activity and nutrition, to understanding those different needs, pelvic floor therapy, lactation support, and mental health support. These are the 5 key areas. And I don't know if you can see me because I keep going in and out, but these are the 5 key areas that evidence shows, and these are evidence-based different points of view that we've comprised, and we're seeing how important it is for moms to have in their postpartum journey. So again, that's the doulas, physical activity, nutrition, pelvic floor therapy, lactation support, mental health support. Those are all things that are important. And just to also add on in terms of the physical activity and nutrition, and Tasha and I have talked about this so much, and I'm so glad we've been able to now share this with more people. But nutrition, people think that after you have a baby or while you're, recovering from just pushing out a child, that you should only be eating green, like leafy greens and all of the healthy foods and nuts and berries and all that stuff. And that's not necessarily the case. If that's what you like, go for it. Do whatever you feel or eat what you feel is going to be enjoyable and that's also healthy. But that is not to discount those cultural comforting foods. It is important for people to understand that that is something that's super important, to make sure that going through your postpartum journey, that you feel comforted, and you can feel comforted through food. My family is Jamaican, so rice and peas, jerk chicken, oxtail, all ackee and saltfish, all of that is something that's comforting to me. And if somebody told me and said, hey, you have to breastfeed, you're doing all these different things. Yes, festival. Yes, I love it. Fried dumplings, all of the things that are so good, but some people may deem it as being unhealthy. That's not necessarily the case. Of course, things in moderation are important, but we just want to make sure that moms are feeling supported in every area. These are important areas. And one of the most important things, and I'm sorry, I'm kind of going out of order, is doula care. A lot of people, they mix up a doula from a midwife from, a doula. They don't know the difference. And there's postpartum doulas, there's birth doulas, but doulas are so important. And there are studies that show how it affects the outcome of the mortality rate for Black women. Having a champion in your corner while you're giving birth, after you've given birth, those are things, it's a tool that is truly invaluable. It's so necessary, and to be able to have somebody that is there to support you, because unfortunately, there are a lot of women that may not have a partner that is right there with them. They may not have a family member, but if they can have a doula that is there, that is saying, hey, this is what I'm noticing, and this is what my client is telling me how they're feeling, there are so many different outcomes that would occur and so many different things that we would see. And going back in order, pelvic floor therapy. And Tasha says this all the time because she's talked with a lot of women and just collecting research, collecting data. A lot of women do not know where their pelvic floor is. They don't know what it is. They don't know the importance and how useful it can be while you're pregnant, and then especially postpartum. Pelvic floor therapy is something that is so essential, and it can help to mitigate those things such as prolapse, things of that nature. It is a tool that is really it's starting to get highlighted a lot more now than it was before, thankfully. But there are a lot of resources out there that prove and that show how useful pelvic floor therapy is. So many women are being told, hey, when you after you've given birth and you sneeze and you pee a little bit, that's normal. It's not normal. So that's where pelvic floor therapy comes into play. And then lactation support, as we discussed earlier, how crucial, how vital it is for Black women to be able to initiate that, to be able to have somebody that can help you. And Tasha can speak to this. She actually has her own story, and I'm going to let her tell you her story when it came to initiating breastfeeding. So I'll let her tell you that when she comes off of mute. And then our last point that we saw here is mental health support. As stated earlier, mental health has become such a stigma in terms of, it was a stigma in the Black community where seeking help made you feel weak. You were told that you have to be superwoman. I think somebody put that in the chat earlier, which is very true, is that Black women are looked to be strong and superwoman all the time. And that's not fair. That's not a fair title to put on to a woman that's just given birth. Like, yes, in some aspects, some respects, you are giving a compliment, but there are times where there's help that's needed. You feel down. You're going to feel tired. You're going to feel like, am I doing enough? We deal with a lot of women, and some of our clients have been so open and expressed that to us, that as a mom, that they feel like they're not doing enough. They feel like their child is lacking. Those are real, genuine feelings, and having mental health support to work through that, to help guide a mom through those things and through those feelings to where she can serve herself. That way she's in a good place to serve baby and any other dependence that she may have. But Tasha, I'm going to let you explain in terms of the lactation support and any other tidbits that you wanted to add, but your story when it came to initiating breastfeeding.
Yeah. So for me, I think in my career now, I've grown a deep interest in lactation support, because it's not something that I had when I was breastfeeding my baby. So myself and my husband dealt with very serious postpartum anxiety. So we lost our first baby, which came from years and years and years of being told that I would never be able to have children. So when we got pregnant, there was, obviously this sense of elation, and then, first baby didn't make it. So, I got pregnant again, and then it's like every complication, like, even especially with my first baby, like gas was a huge deal. Like, cause I didn't know, I didn't make it that far in my pregnancy the first time. So I wasn't sure what to expect. So when it got to breastfeeding, my mom did not really breastfeed. And I have a family member whom I love dearly, but she was really the only person I knew that had regularly breastfed. So, for me, I had to know how much my babies were eating at all times. Like that was, I guess one of the symptoms of my anxiety at that time. And I had to know, like, if I didn't know how much she was eating, like I couldn't sleep at night. So it was easier for me to pump, but I knew the benefits of breastfeeding. So I went to this family member and I said, hey, I'm struggling. I really don't know how I can, do this, or, how I can make this work, because I know if I breastfeed, I don't know how much she's getting, and it's driving me nuts. And this lovely individual told me, oh, I didn't have that problem. I had perfect nipples. My babies had no problem latching. I was good. So I really don't relate to that. And I was like, I appreciate you telling me about your perfect nipples, ma'am, but that does not help me in this moment. And it, but, and that's something that we've heard regularly from our clients, right? My mom had to go back to work after she had myself and she had my sister. So there wasn't really a great duration of time for breastfeeding. She was a single parent for a few years. So, she had to prioritize working. And, this individual, and this happens a lot for our moms. Like and we'll talk about the data that we've collected with our clients, but over 70% said that they wanted to initiate breastfeeding. The national average is 83.4% will initiate breastfeeding. The problem is continuation. And you have not only a lack of support in systems, but a lack of support in communities. People don't know how to talk about breastfeeding. I don't know why, but they don't, right? And we work with an amazing, amazing nurse practitioner who does a lot of work, and Dr. Sandra Ojurambe does amazing work in Nigeria. And she says when you go to Nigeria, it's second nature. There's no awkwardness, there's no nothing. It's if you have a baby, you feed the baby, you move on. Whereas here, there's so much that goes into feeding your baby. It's whether you cover your baby, do you feed your baby in public, do you feed your baby in the bathroom? And when you try to go to family members, you get what I got or worse, right? We've read stories. There was recently, people have seen, Kyla Pratt, I think, was talking about her experience with breastfeeding, and she was saying that she got judged for feeding her baby for, longer than a year. And they're like, oh, you still feeding that big old baby? It's her baby. She's literally providing the best nutrition possible for her baby, but it comes with all this negative stigma. That stigma is stress, and stress impacts your ability to breastfeed. Right? So it's like this continuation, this ongoing loop of struggle on top of the complicated past that Black women have with breastfeeding in this country. And it's like there's no help and there's no support. And that's why this was one of those key, evidence-based roles that we wanted to have in this model, because it's so often looked over. And we had a meeting with a doula a couple weeks ago, and she's absolutely the best. But she said that the problem is not when you're in the hospital, the problem is when you're at home. That's where moms decide to stop breastfeeding because they lack the support to continue. Whereas if you have the support, you have the education, even if you don't have somebody that's available for you to text at 2 a.m., you know that, if you can make it till 8 and you could try your best and do your best and pump if you have to, you have the resources you need to pump and make sure baby is fed, someone is going to be on the other line to help you. A lot of moms, including myself, don't have that. So that's my experience with, lactation support and breastfeeding.
And just one last thing to make sure, I don't think I covered it, but as you can see, if you can see the screen, we make sure to include your community builders around this evidence-based model. So you'll see family is included in this, your partners, whatever healthcare team there may be, friends and coworkers, employers. So it's not just where it's a community, it's just the one, the mom, she's having to figure all this out. But it's a community that comes together, and your community may look different from the person next to you or the person down the street. It does not need to all be a family member. You can have a really close coworker that's concerned, and they say, hey, I know this person, let's help and get you connected. It could be an employer. I know that that sometimes there are a lot of large corporations, they are starting to add more benefits for maternal health. So that's just something to also take note of, is when we're dealing with this care model, it's not just the mom by herself. It's not just the mom and the one provider. It's mom and whoever else is around her who she feels comfortable with to help support her during this time. All right. So this is what we know, right? This is, and I'm not going to go through every single point on here. I believe that everybody can read. So I will let you take the time to look through, but I am going to just highlight some of the different parts that are important, because this is what literature is saying about these different roles that are supportive of maternal health outcomes. One for doula care, it's decreased C-sections. Another one, and that's something that is huge as well. And we've talked to different people, and I know Tasha actually has a colleague that is in another state, and she worked with these different doctors. They would purposely, intentionally schedule C-sections so they could make their golf appointment, they could make tea time. These are things that happen today in this country, where doctors are encouraging and they're saying, we're just going to book you for a C-section because we want to be able to make sure we make whatever entertainment appointment is important to us more than your health. That's something that's scary. Gratefully and wonderfully, that particular colleague that Tasha has said, okay, and she knows this because she plays golf with them, and they would brag about this while on the golf course. So she's hearing all this and she's like, oh yeah, I hear you. I'm never sending any of my patients to you. I am going to tell them not to see you because of that reason. These are things that are happening. And I don't know about you, but for me, that is scary. That is scary to know that there are doctors and providers that think like that. So regardless, having a doula is huge because that will limit things of that nature. Unless there are, of course, valid reasons why a belly birth is needed, why a cesarean is needed. Outside of that, just doing it because of ease, we want to decrease that. So also, we can talk about the increased breastfeeding. That's also a positive of doula care. So doula care and the lactation support really go hand in hand. Not every, and correct me if I'm wrong, I know not every doula is also a certified lactation support individual, but they do have a lot of education and a lot of knowledge when it comes to initiating breastfeeding. So that is something that is super important of why doula care is an evidence base and it's needed for moms in the postpartum period. Again, going to lactation support, increased breastfeeding can help to reduce the risk of breast and cervical and ovarian cancers. That is something that is huge in our country. And as I read previously to you guys and talked about it, that is a large amount of Black women are being diagnosed with these different issues in terms of the ovarian and cervical cancer and breast cancer. So lactation support helps with that. When it comes to mental health support, decreased episodes, decreased depressive and anxiety symptoms, early detection of symptoms, and again, linking to breastfeeding. That is something that's super critical. When we look at nutrition, physical activity and nutrition, increased muscular strength and abdominal muscles, improved sleep. These are things that are huge. And pelvic floor therapy. There's going to be that early diagnosis, as mentioned before, of prolapse, something that is so scary. And when it happens, it's very terrifying to a woman that experienced that. So when you have the pelvic floor therapy, that's something that we're able to help to diagnose prior to it happening or to avoid altogether. Here you go to the next slide.
I apologize. I'm out here chatting in this chat box. We got some great comments coming back and forth. Okay. So let's look at the data. So we pulled data. So to date, we've served over 1,000 women across the country and in Canada. But we pulled data from a specific 164 mamas that have requested packs from us over the last, I want to say maybe 45 days. So if you look at these, the kind of eggshell looking color is, we're just going to say is no, whereas the lovely yellow is yes. So if we look at these, we have a brief survey that is that moms fill out when they request packs from us. We provide postpartum hygiene supplies for mamas free of charge. They just have to go on our website, fill out the form, and we'll ship it to you. And if you're local to South Florida, we'll deliver it to your house. So for these 164 mamas, we asked them, have they sought out a doula? Have they are they interested in or have they received or plan to receive pelvic floor therapy? What about nutrition and physical activity? Do you have someone that supports those things? What about lactation support? Do you plan to initiate breastfeeding? Do you plan to seek lactation support? And then we connect the dots to see who has coordinated care, right? So who has at least 3 or more of these key services in their community. So for doula care, about 107 out of 164 moms are not seeking doula care. Most of our moms do not know what doulas are. When we have client appointments where we meet face-to-face with clients, many of them don't know what doulas are. So we have to explain, we tell them what the value is. One of my favorite things that Rachel says is your doula is going to be your advocate in your most vulnerable moment, because there is nothing more vulnerable than having a baby, especially in a room full of strangers. And I feel like every time she says that, it just clicks for our clients. And they're like, yes, so how do we receive doula care? Pelvic floor therapy. As you can see, about 159 out of 164 moms said they do not have a pelvic floor therapist. Like Rachel previously said, most moms don't know what a pelvic floor is. Most people don't know what a pelvic floor is. That is the netting of muscles that holds all your internal organs up, that is greatly impacted by pushing a human out of your body. Same thing with the belly birth, right? If multiple layers of skin and muscle and fascia and tissue are being removed so that baby can be safely, hopefully, taken out, all of that impacts the netting that holds up your internal organs. It's about the same with nutrition and physical activity. If your first priority is baby or working, what's the likelihood that you're going to invest time and resources into your own nutrition and your own physical activity? Mental health support. We have found that a lot of moms, a lot of our Black mamas are interested in receiving mental health care. About half of them are interested in receiving mental health care during their postpartum period. Whether they do is something different. Right now, we work with a cohort group, and about 8 out of 10 of them are actively seeing mental health support, which is amazing. Lactation support. As you can see, about 8 of these moms out of 164, so about half, do not have lactation support. Now, remember I told you previously that 70% of them want to initiate breastfeeding, but many of them don't seek lactation support outside of the hospital. And out of all 164 moms, we only had 1 mom that had employed at least 3 of, and this is without our help, because once you connect with us and you become a client, we're going to find them for you. But prior to her coming to us, she had at least reached out. She had talked to a doula. She has a therapist, and she was interested in her nutrition and did her best with physical activity and has sought services for that. But she had a doula that fell off, so we had to find her another one. Like, there's so many different things. She couldn't work because she's high risk. So she's been sedentary, which is part of the reason why she was interested in physical activity, is because she's been sedentary for most of her 3rd trimester. That's 1 mom out of 164 women. Like these statistics are rough, and we're seeing this continuously. Like, these things that are relatively simple, especially when it comes to, like, we hold OBs and midwives to, you know, in the highest regard, especially our Black women that do this work. But the buck starts there. Like, this can't be an exception of care. This can't be, you know, mom is high risk, so she needs access, or, you know, gestational diabetes, you need to exercise for some number of times a day, and then here's a nutrition plan. That's where we should start for every mom. It has to be preventative. It has to be proactive. Otherwise, Black and brown women are going to continue to suffer. Not only are we being ignored, we're receiving less than half of the care that we actually need. So we're going to reason together, and we're going to reason together the best we can via this. And we have about 9 minutes, so we're going to reason together quickly. Let me see. Okay, we have a question. Is your service based out of South Florida by the esteemed hospital? Yes and yes. So yes, we are based out of South Florida, but we serve moms all over the country. And yes, the hospital that I went to was in South Florida. Yeah. Yeah. Great question. I don't know who wrote this, but if you want to let me know or send us an email, I would love to know your experiences and the reason why you asked that question. Okay, so here's our case. And we're going to reason together via the chat box. So meet Amanda. This is your new client. Okay, so we have our care model, you know, those 5 key roles, as well as the OB. So we're going to pretend that everyone on the call is an OBGYN or a midwife. And remember what I just said, the buck starts with you. So you have a 29-year-old, no history of chronic illness. Their community, we always ask our clients, who's in your community? That's where we start. We do postpartum planning, we do, you know, we community build, but we always start with who's currently in your community. So she's got a supportive partner, parents, in-laws, lots of extended family, previous history of loss, suffered postpartum hemorrhage with first birth, and partner and her suffered from serious postpartum anxiety, including hypervigilance, serious trouble sleeping post first birth. Neither of them sought mental health support. First baby was fed breast milk via pumping for 9 months, was told to supplement with formula. I don't even think it was 24 hours prior to her leaving the hospital. Was given samples from what I understand. The mama was an elementary school educator and worked up to a few days before the birth. Dealt with severe pelvic pain during the pregnancy, which sometimes required days, like had to take days off because the pain was so bad that she couldn't walk. Okay, so we're gonna edit this. We're not gonna do breakout rooms, but you've all had the chance to, you know, introduce yourselves in the box. But tell us if you are a midwife and OB, right? And you have these different roles. So in the chat box, tell us how using the care model that we've given you, lactation support, doula, nutrition, physical activity, pelvic floor therapist, mental health support, how would you use these services to support this mama and why? I'm going to go back to the actual case so that way you can see. And I want you to pick specific things from mom's history and how you would use this care model to support mama in the next few minutes, because it's 8:54.
How is her living situation? Is she rich or a poor part of town? We'll say middle class.
I'm just sitting here talking, not realizing that I'm muted. Thank you, Malcolm and Rachel, for telling me that I was muted. How can we use these roles to support our mama? So I see really good answers. Implement mental health services, coordinate with doula for pregnancy, find Black lactation consultant for prenatal. Thank you. Lactation support prenatally and postpartum, preferably one that offers in-home services. I'm muted. Hemorrhaging should be dealt with by OB and needs lactation specialists on board for breastfeeding. Yes, pelvic floor therapist, IBCLC, letters for light duty. Oh, thank you. medical leave, support belts, hands-free breast pump, mental health services, an appointment to start virtual. Very nice. After ensuring that she has adequate prenatal care, I would recommend that she seeks mental health assessment. Very cool. Get a community health work. Yes. Love that point. Lactation before birth. Amazing, amazing, amazing answer. So if you all have not figured it out as of yet, based on my story, this is me. I had my second daughter 16 months after I had my first, and I was 29. Both my husband and I suffered from severe postpartum anxiety. I worked up until 4 days before my daughter was born because I didn't the first time and I was bored. And I suffered from severe, severe pelvic pain. Herbal and homeopathic support, yes, right? Like this is me. I wish I had had individuals like you all in my corner when I had my babies. It was during COVID, so even my parents couldn't be there. It was me and my husband, and that was it. And he was the best support anyone could ever ask for, but he was also exhausted. He was doing all the jobs on top of us having to advocate for the AIM toolkit, which is federally mandated by the government for the postpartum hemorrhage, right? Like all the jobs. Mom should not have to be everything to everyone at all times. A traditional, yes, I had a midwife. I did. And that was one of the best decisions I ever made because she played no games. And I wish you could see the face she made when that nurse made that comment. It was crazy. I did not have an assigned OB at the time. I was kind of cycled through the OBs that were in the office just in case I had to have a emergency cesarean. And when I say I've never had a faster doctor's appointment in my entire life, it was the same thing with all three of the OBs I had to meet. And one made me wait like an hour and a half longer than my appointment. And I was a teacher at the time. So I was literally going from work trying to get back. I did. Yeah, she's a nurse midwife. The best. But she was also trying to keep me from bleeding out. Everything to everyone at all times. We can't do it. And that's why we built the PCC. That's why we created this model. So that way, not only are we providing mom with just a beautiful encompassment of support, but also, so these practitioners, your doula won't have to serve as doula and mental health support and lactation support, right? Because more than likely, doula is managing her own life, her own family, or their own life, their own family. Other clients, right? The goal is to build a care team that can support mom. I'm gonna keep going and answer this question. How did you deal with anxiety? How was your husband support? Prayer. There was a lot of praying that had to deal with the anxiety. It was rough. And eventually we talked to his parents and my parents. And, we were honest with, Rachel. We talked to people, we talked to friends, we talked to really close friends that he's grown up with. Yes. In most cases, churches can help. In some cases, church can be traumatic, but thank God in our case, church definitely helps. But yes, so that was what got us through it was, really, he's the best, the absolute best, my husband. Yes, but that's what got us through it was just being honest about our experience and hearing that we weren't alone in that experience, hearing from other people that, yeah, we've been there. Yeah, we get it. Like Rachel is godparent to basically both of my kids. And she listened to us. Like she heard what we had to say and there was no judgment from the conversation. Like neither of us are mental health professionals, but that listening ear, that's another reason why doulas are so invaluable because just listening to mom's birth story, that in itself is powerful. And Rachel was willing to listen. Okay, thank you all. You all are just the best. Okay, so who's in your community? And I'll ask this question and kind of, trail off here, but what opportunities for connection did you identify in your service community? And that's one big message that we want to leave everyone with is you can't be everything to everybody all at once. And I feel like if you get into this field, we feel like we are currently experiencing, when you get into this work, there is this inclination to want to do everything because you see the need. You see the problem, you've seen the statistics, you've experienced the loss. We have colleagues that have lost moms and they carry it. What we would ask you to do is not to carry it alone. that's another point of this PCC model, is to find a community that's not only supportive to mom, but that's supportive to you as well, that can give you insights and, you know, help and assistance where you need it. So, you know, mom is supported, but you don't have to be everything to everybody all the time. It is 9:02, but any questions, comments, reflections, we encourage you to please share them in the chat box. We are so grateful. We are grateful for your time. We're grateful for your engaging with us this evening / afternoon, depending on where you are in the country. Rachel, would you like to add anything? I feel like I went through too many slides.
No, you did great. And I'm going to just reiterate what you said and thank everybody for their participation, for giving answers. And thank you most of all for what you do. It's so huge and important and needed in our community. So we are so grateful for the work that you do every day, because it's not easy. So thank you again. There is one question. How can we implement the model in our community? Oh,
We can help you.
thank you.
That's
Mhm.
part of what we do. Is so depending on where you are, it's what we do for our clients, and it's something we want to transition, and that we're being asked to transition into doing for organizations. Is helping you identify these key roles in your community, and we'll help you. Like, we'll reach out to them, we'll connect you with them, we'll, you know, set you up to do warm handoffs with the people that you serve, so that again, they know they have someone in their corner. It is not a stranger looking over their shoulder, but it's someone that they know is going to have their back. And we'll make sure you meet with them first. And if you're good and you're like, yes, this is a great lactation support person that will be great for our community, we're good. If not, then we'll find someone else. But we can definitely help you. Dallas, love working with all I do is, I love IBCLCs. I want to be one day. It's so much work, but goodness, like the work you all do is just, and there's so few, especially in hospital settings. It's aggravating. I would love to stay connected. Oh, like me. I'm gonna copy and paste this right now, Brittany. Rachel is our designated community builder. As you saw, she is our director of client and community relations. So we will make sure to reach out. Thank you so much for your time. Thank you all so much.
Yes, thank you guys so much.
Let me stop sharing. There we go.